Well, good morning, everybody. I really do appreciate you coming here. Today I will be introducing the Trickett-Wendler Right to Try Act of 2016. And I don't want to spend a whole lot of time talking here because I really want Matt and Tim and Jordan and Laura to primarily make the case for why this is such an important bill. I met earlier with a group of ALS advocates and Betsy Burning from Racine, an ALS patient herself. But my involvement in this issue really dates back well before I became a United States Senator. I never understood in the land of the free, home of the brave, why people with, let's face it, terminal conditions, why we didn't allow them to choose whether or not they wanted to try an experimental treatment. You know, we all want safety. We all believe that there's some form, some measure of government regulation to make sure that people aren't selling snake oil. But at a certain point of the process, some of these experimental drugs, the right to choose whether you take those or not, to give yourself hope, ought to be left in the hands of the patients and their families and the doctors, not federal bureaucrats here in Washington, D.C. So, from a legislative standpoint, my first involvement in this really was an effort that I heard out of the Goldwater Institute. And I met Darcy Olson, and their effort really was state-centered. And now they've passed right-to-try bills in 28 states. And this bill really is trying to pave the way to make sure that those states can continue to have effective right-to-try laws in their own states. Just make sure the federal government doesn't get in the way of states' rights and the citizens of those states to be able to have the right to try. But where I really got involved in this was really about 2 years ago when I met a wonderful woman, Trickett-Wendler, Tim's wife, and I had just literally talked to Darcy Olson about this. And Tim came in like Betsy came in today with a group of ALS advocates, and of course Trickett was the patient. And I just mentioned this new effort that I'd heard about the Goldwater Institute, Right to Try, and tears started streaming down her face. Just talking about it. Just the possibility of giving Trickett some hope. And that's really what this piece of legislation, what these efforts are about, is providing patients hope. So again, I've been involved in this. We've been working with the FDA in terms of their expanded access application process. That's a method that can be helpful. Unfortunately, we're not hearing a whole lot from them. But the facts in terms of how onerous this application process is for new drugs. In the year 2013, the year 2004, it cost about $1 billion on average to bring a new drug, to have it developed and get it approved. Now that price tag's up to $2.5 billion. In the 1999s, the approval process from development to approval was a little under 10 years. Now it's almost 14 years. So this big bureaucratic process of the FDA, and let's face it, with information technology, with the advancements of science, if anything, we ought to be increasing the speed. I mean, those approval processes, because of science and our capabilities technologically, ought to be reducing that. It should be quicker to market. We should be producing more hope, and actually, we're reducing those times, driving up the costs. Something has gotten off the rails here. And this piece of legislation is a sincere attempt, again, to try and put it back on the rails, speed the time of innovation, make these therapies more widely available, but give these patients hope. So without me really yammering on anymore, I guess what I'd like to first do is turn to Tim Wendler, Trickett's husband, and you've gone through this process. Can you kind of speak to just the human element of why this piece of legislation is so important, Tim?
Yeah, thanks. First, thanks to Senator Johnson and the members of the committee and the staff and everybody that's getting behind the bill. I think you're right. I think the most important thing that this bill does is it provides hope where there is none in a terminal illness. The opportunities for hope are few and far between. Certainly, that was our experience. Trickett was diagnosed 3 years ago with ALS, and we were like everybody else. We were disappointed in every meeting that we went to, every doctor. And we scoured. I'm confident that we exhausted our efforts going around the country to find the best scientists and the best doctors out there, and just time after time, just continually disappointed in the lack of progress being made in this area. And so hope starts to fade. Hope goes away. And so, having a bill like this introduced, giving somebody an opportunity for hope is something that's incredibly important. The particular strain that Trickett was diagnosed with ALS, it's not as common in every ALS patient, but it's a hereditary strain in our environment. And so the drug that she was prescribed was the exact same drug that her father was prescribed 25 years ago. There was literally no progress being made. And it only, in its best case scenario, it extends life for like 3 months at a time. And now, Trickett now has passed. About 14 months ago, Trickett passed away. And, and so we continue to advocate. I've got 3 kids. We've got kids that are 12, 10, and 8 years old, and they're predisposed for this gene. So, it's unacceptable, in our eyes that we sit around and do nothing. There has to be hope. We've got to be able to create opportunities. And we're not talking about, I think you're right, we're not talking about a kid in his basement with a chemistry set. We're still talking about regulation. We're talking about, having oversight over that. But there has to be the opportunity in these investigational drugs for discovery, because there's things out there. We're closer than ever. There's hardworking people, scientists and doctors all over the place that are working hard on this. But we need more hope, and that's what this bill does for us. And so that's my involvement. That's why I'm excited about it.
Well, again, thank you, Tim. By the way, you're from Waukesha, Wisconsin. So now we're going to turn it over to the star of the press conference here. Certainly, Jordan attended a hearing here on, February 28th, where we talked about Duchenne muscular dystrophy. And Laura was, I guess, the last speaker at a April 26th FDA advisory committee specifically on this disease. And I would say the results were very disappointing. They voted 7-3 against approving a experimental treatment therapy for Duchenne MD. And unfortunately, the FDA concurs with those advisory panels 74% of the time. So that was pretty disappointing. So I'd like to have Laura to speak to that, but let's have Jordan first speak, because he's going to be the star of the show here. Jordan?
Thank you for the drug.
That's okay. Okay.
Thank you, Jordan.
Thank you, buddy.
I guess he probably needs that Chairman Jordan that we had before.
Okay, so he's going to go.
Okay, yeah.
Go back there with Josh, okay?
Anyway, Laura is from Indianapolis, Indiana. Laura and Jordan.
Good morning. If it's okay, I'm just going to wait just a minute until my son exits the room. Jordan's getting a little older, and so there's some things that I really don't want his ears to hear, and I'm not going to dwell on this part, but for just a moment, I want to just give you a summary of Jordan's condition and why the right to try law means so much to my family. As Senator Johnson said, Jordan has Duchenne muscular dystrophy. This is a rare disease, and it affects 1 in 3,500 boys. And even though Jordan looks like just a happy, healthy little boy right now, what's happening inside is that his body is not producing dystrophin. So his muscles are deteriorating. And during his childhood years, and notice I say childhood years, he's going to lose, without a miracle, he's going to lose his ability to walk, to dress himself, to feed himself, even to raise his arms up and just give me a hug, all before he's an adult, if he's lucky enough to make it to adulthood, because he has a very short life expectancy. His disease is 100% fatal. He also can't wait until he's in the final days to access the drug that exists. And let me back up. There are drugs in the pipeline that can help Jordan. And as Senator Johnson said, we just attended an FDA AdCom panel to seek approval for an exon-skipping drug that could actually slow the progression of the disease. The panel, the questions really weren't worded in a way for them to include some legislation that was passed in 2012, which says that the FDA has to take the patient voice into account. And so maybe there needs to be some reform there at some point, because they were really set up to not even be able to say yes. to the questions that they were asked. So the FDA has a decision to make before May 26th as to whether or not they're going to approve this drug or not. And we're still very hopeful that that could happen. A few weeks ago, though, we testified at a Senate hearing led by Senator Johnson to discuss ways to get terminally ill patients access to these treatments more quickly. One thing that we discussed was this right to try legislation, which basically gives patients the right to try medications that can save their life. And we're talking about treatments that have already made it through phase 1 with the FDA, so they're safe. And oftentimes they're effective, they already know that they're effective. The drug that we're waiting on for Jordan, we know it's effective. I've seen these boys walking and doing things they're not supposed to be doing at their age that are taking this drug, but it's not approved yet. So Jordan, unfortunately, can't access that. I'm sorry. So that day at the hearing, one of the things that we talked about as a solution was right to try legislation. So I want to say thank you to Senator Johnson for acting so quickly. I asked for a couple of things at that hearing, and one was right to try legislation, and another one was just to hold the FDA accountable for the laws that have already been passed. They already have the authority to expedite approval of drugs that show promise, and they're not doing that. They already have it. You gave it to them in 2012. It was signed into law. It had a lot of support, but it's not happening. So we're hoping to see that happen. And for our family, we also have a lot of hope that, right to try could be another option if that doesn't happen. I'll never forget the day last year, Jordan and I lobbied in our home state of Indiana to get the right to try law passed. And we got to be there the day that Governor Pence signed into law. And I'll never forget how much hope that we felt that day. I mean, it was like, okay, we finally have maybe, something else. If the FDA doesn't come through, we have some other kind of hope. And so today, we're here to celebrate as Senator Johnson introduces this at the federal level. And we're so grateful that you're doing that because we think every single human being has a right to control his or her destiny. And that's what the people want. And it's just the right thing to do. And if it's okay, I would like to close by sharing Jordan and I's life verse from the Bible, and it's Jeremiah 29:11. And it says, "For I know the plans I have for you, plans to prosper you and not to harm you, plans to give you hope and a future." Senator Johnson, thank you so much for giving us hope today. Thank you for caring about what the people want. Thank you for caring about the value of life and Jordan's future. I look forward to seeing the rest of the United States Congress stand up for Jordan's right to try, for the people's right to try. Thank you for doing God's work. Thank you for giving our family hope today.
Well, Lord, thank you for sharing the story and for advocating. Thank you. But by the way, they're all star witnesses, but obviously Jordan was the big star.
Yeah.
Our third star witness, Matt Ballina. And by the way, he and his family put out an excellent video that I'd really recommend everybody to go online and see. But Matt is one of the finest among us, a naval aviator who was diagnosed with ALS from Bucks County, Pennsylvania. And Matt, if you can kind of tell your story.
Yeah, thank you, Senator Johnson. I had actually some remarks planned, but a couple things just changed that. First, I didn't know, Tim, that you were going to be here today, and I got to tell you, it's pretty emotional for me because Trickett's video, the one with you tying your tie in the mirror, that's what got us started on this thing. My wife and I saw that, and we actually drove down here. So thank you, guys. It's pretty remarkable to be sitting next to you at this moment. The other thing is, seeing Jordan reminded me of something. I joined the service. I commissioned in May of 2005, and I served for 9 years and 9 months in the Navy. And I did love every minute of it, but was also challenged. And during the challenging times, I thought about, kids like Jordan. I didn't yet have any kids of my own until a couple years ago, but even before that. And when I thought about, what our role is, as service members for them, it was about preserving their life, liberty, and pursuit of happiness. And it was about hope for everybody. That's what I think all service members that's what motivates everybody to get out of bed and face the hard days, in or out of the service. And, the idea that, we're going to make our world better for, our children. And so seeing Jordan, I'm reminded of that. And I'm pretty moved to think that, we still have to keep up that fight. We don't fight. We fight on principles for life, liberty, and the pursuit of happiness. Our principles are not to provide an abundance of caution or the illusion of safety. We're about giving people the chance to do what they think is best for them. And when you have a patient and a doctor and a pharmaceutical company coming together and saying, this is providing hope for us for a better life, there shouldn't be anybody standing in the way. And it saddens me greatly that in this great country of ours, I'm allowed to take my own life in some states, but I can't try an experimental treatment that may save me. So, Senator Johnson, I'm so grateful. I'm so glad to have met both of you as well, and Jordan. And God bless you. Thank you.
Well, again, Matt, thank you for your service and sharing your story. Now, just a quick aside or another point before we turn over to questions. I hope you basically directed to our witnesses here. My first child, my daughter Carrie, was born with pre-serious congenital heart defect, and during that process of getting her corrective surgery, her heart operates backwards nowadays because at the age of 8 months they rebaffled the upper chamber of her heart. But the thought occurred to me. You always hear the term medical practice, and I really came to understand what that means. It is practice. It's the skill, the dedication of medical professionals who dedicate their lives to saving other people's lives, putting that skill to use in some pretty desperate situations. And there's no one particular drug, there's no one particular patient that reacts the exact same way together. So, again, I think this effort is just so incredibly important to advance science, but again, to advance hope. But with that, really, I do want to open it up to questions for the people on the panel here, and we'll start with whoever wants to ask a question. Anybody?
Senator, the other thing, hope is great, but disappointing when things don't happen. It's horrible. What time frame are we looking at to try to get this passed, this right to try?
The what?
What's the time frame to try to get this done? Because every day these folks get closer to not being able to.
I could go down the floor of the United States Senate and ask for UC today. And hopefully there'd be no objection to it. There might be, because I think there are objections to it. So what we're going to do is diligently try, working through the committee process, try and knock down every objection there possibly is. And what a lot of people don't understand is so many things in the United States Senate passes, not because people vote for them, but because nobody objects to them. The reason we're holding this press conference today is to put a human face on the bureaucratic stumbling blocks to providing these individuals hope. So again, I'm hoping this will be a powerful news conference here, and it'll hopefully knock down any resistance, any kind of objection to this. I'd like to see this passed in a month or two, quite honestly. I'm not sure we can accomplish that, but we're going to press really hard to get this passed.
Other than what you're doing, what should we do as citizens to try to, what do you recommend us to do to get this done?
Continue to advocate. I mean, I cannot tell you how important it is and how much I appreciate that Tim and Matt and Laura and others, Betsy, I mean, the groups that came to us to put a human face in front of members of the Senate and members of the House and their staff. That this isn't something theoretical. This isn't some wonkish policy. This is about real people that just want the right to try. So that is incredibly powerful. Remember what got me involved specifically with this policy. Listen, I came here because we're mortgaging our kids' future. But the fact that I met Trickett and just mentioning right to try, that tears started streaming down her face, go, well, gee, this is something we really ought to push. Okay? And so that's why we're doing it. So the advocacy, meeting with members of Congress is probably the most important thing you can do. Double, triple, quadruple your efforts over the next month or so, and let's get this passed.
Great, thank you.
Senator Johnson, we appreciate your doing this and helping to bring this to everyone's attention. This is Frank Bongiello. He is with Matt Ballina. A year ago, Frank was helping, like many of us are standing in this room today. And Frank, if you could just say a few words. He was diagnosed in October last year.
Can you come here and we'll put...
Frank's story is extremely
Maybe just turn it
powerful, how ALS that many other terminal illnesses are not a one-size-fits-all disease, and why the right to try is so critical.
Yeah, Tom. I too would like to thank you, Senator Johnson, for bringing this forward, because it means so much for help for me and my family. And, you know, for seeing his assassination, Abraham Lincoln often said, if I'm killed, I can die only once. But if I dread it, I die over and over again. I have a 80% chance to be dead in 2 years. And for me, seeing these potential drugs out on the market and not be able to take them, it's like dying over and over again. So I plead with everyone to stand behind you and pass this bill, because we don't have the luxury of time. You know, it's going every day. I have 6 children, a wife, and a great family, and I'm not ready to leave them. So this should be a bipartisan support for this bill. As Matt said, life, liberty, and the pursuit of happiness. So thank you so much from my heart for bringing this forward.
Well, Frank, thank you. And staff, what we're going to do is we're going to make sure that video of Frank providing that powerful testimony will be sent to every member of Congress. Okay?
Thank you.
That is exactly the kind of advocacy we need. Thank you for speaking for the heart. God bless you and your family. Thank you. Thank you for doing that.
He was diagnosed in October.
Yeah.
So a very healthy, fit man.
Frank, can you tell us about your family?
Yeah, well, my wife, Marilyn, we've been married for 23 years. I have Alyssa, she's 21. Alexis, she's 19 or 18. Eric, he's 19. Samantha, she's 14. That 10-year-old twin second Zoe. And they mean the world to me, so I'm not ready to let them go. I don't want them to have I don't want them to have to grow up without me. So,
We don't want them to grow up without you either. So
that's all we have. Our family and hope. So,
well, God bless you.
thank you.
Thank you. Thank you very much.